This presentation is on interventions for those with cognitive impairment. And we want to think about different ways we can provide activities and stimulation that's helpful for individuals with cognitive impairment and also help them adjust and prevent those stress reactions. So there's a lot of different general interventions that are helpful. Things like reducing clutter and being flexible and slowing down, reducing noise, do difficult tasks when the person is most able or willing, walking and singing. Sometimes mirrors can be really bothersome, so we can remove those. We could have a chest of drawers or a box for rummaging and hoarding. That can be really helpful. Maintaining a routine, use lighting to our advantage, and we've mentioned anticipating stress responses. Make sure we do that and prevent them. And then keep reminding them to look up and straight ahead when they're walking, because they'll want to keep looking at their feet and eventually they're going to topple over. Some more specific interventions: assistive technology, adaptive aids, ADL training. There's all kinds of rehab that we could also use, but we could do environmental modification and then reminiscence therapy, aromatherapy, music therapy, animal assisted therapy, life story. Those are all very specific interventions. I provided some videos that talk about a few of these to highlight what each of those are and how you might set those up in a facility. That could be really helpful. And then the rest of this presentation, we're just going to highlight some of the different types of interventions or aids that we could use that might be helpful. Some you may have seen, some you may not have, but sometimes we'll come across something that might really help a particular resident or a particular need. So it makes sense that we do real basic things like hand bars in the shower, changing the height of washers and dryers. If they can't talk, to provide a talking board so that people can express what they want. They now have GPS tags that we can put on shoes, and that'll show if someone has wandered outside of the building. And that can be helpful if you're concerned about wandering. If we're worried about falls, there's a lot of different types of technology for that as well. They now have hand bars that can go from ceiling to floor. It provides a very sturdy grip to hold on to. Mats to help cushion a fall. We can put the beds completely on the floor so that we're not falling quite so far. And this final is a Mary walker. People can still fall in these, but they can also sit down real readily when they get tired. It's good for people who wander but aren't going to grab their walker and are at more risk for falling. There's all kinds of different trikes. People can stand, they can sit, and they can get about where they want to go in kind of a nice, convenient, and enjoyable looking device to help with walking. Different types of technology we can use to get someone to and from the bathtub and toilet. It helps to have some memory aids, some clocks that have much larger print, some different types of things that can help in visual approach, images that'll help remind us of where things are. One of the interventions is about music, but we can also do some singing therapy. Singing to persons with dementia is a really nice evidence-based method. People become more compliant and they express some joy and relaxation, and they'll probably even laugh with you if you mess up on the words. And if you're off key, it's not going to matter, but that rhythm and melody can help people move more smoothly. And individuals with Parkinson's, it helps get their feet moving quite often. Music therapy with dementia patients can be really, really impactful. This gentleman hadn't spoken for quite a long time, and he's swaying and dancing with the music when they put it on. It elevates their mood and promotes that movement, and it may encourage people to actually be vocal and to verbally describe what they need. Errorless learning basically strives to reduce errors. Um, it's a motivation to select things that are important to remember or once familiar, and we help teach them to relearn face and name associations. We can combine it with other interventions for the best effectiveness. Here's some of the images we might use for maybe signage around the house or around a facility. Cognitive stimulation therapy is a program of themed activities that's carried out over several weeks in small groups. It's usually led by a nurse or an occupational therapist that's been trained in this type of therapy, and it's designed to improve cognition and memory. And we see a significant improvement in memory and language skills and increased self-confidence and well-being. ADL training is usually done by physical therapists, but it helps relearn specific tasks for self-care. It can be basic or it can be advanced, and we may need to repeat it with someone with dementia over time because they're going to continue to lose. But it can be really helpful at different times, maybe during or following a hospitalization, and to get them readjusted to their own home environment. All different types of signs or photographs that we can use for communication to help people identify what they want and to express some thoughts a little more clearly. We can also use sensory type pouches for dementia care. You can put different different types of things inside baggies. Here they've taped off the edges so nothing will get out, and you can warm some of these. You can have your resident look for something like a color or a certain type of shell, and those types of activities for someone who has a severe cognitive impairment can be helpful. You'll also see some other type things. Sometimes they'll use blankets or lap pads with tags, fidget type pads that they can kind of fidget with, or a weighted blanket. Some lap pads, people will place certain things on that are fidget type items like bows and buttons and different types of fabric that feel differently. And then some of the things they use in occupational therapy are shown in the middle two images, and residents can work on screwing those bolts on the screws or finding the right piece to go in a puzzle. Some of these are for individuals that have much more cognitive decline and than others. Some other fidget type items that you might have, and an example of a fidget board for perhaps gentlemen with clasps and locks and switches and things that might be more familiar for a male patient. Then reminiscence therapy, using a scrapbook can really help. At some point the resident's not going to remember who is in which picture. And they might not remember what happened or what event they were getting ready for during these pictures. But if you can think about and talk about what they might be doing, or look at how happy they are, the people in this picture, that can also be helpful. It usually sparks some recognition, even if they don't remember everyone that's in the picture. Now, individuals who have Lewy bodies may need some specific interventions that are slightly different. They may need to have their care organized so that the caregiver is outside of the visual field. So you'll hand them things from behind them. You always want to make sure you approach from the front and introduce yourself, but they can have a lot more triggers and agitation and aggression. And so you they may think that you are trying to manipulate them when you indeed aren't. Medications can be very tricky for patients with Lewy bodies dementia. They have an extreme response to sedatives, meaning that they become extra sedated. Antipsychotics can cause severe muscle rigidity and death. Parkinson's type medications will make the stress responses worse, and medications to treat stress responses increase the Parkinson's behaviors. So typically the medications for other types of disease or behaviors that they're having don't work for patients with dementia with Lewy bodies, and we have to find the right medication. And then you'll have people who have hallucinations, and you need to work on redirecting those individuals who have hallucinations. There's no reason to deny that those hallucinations are there. So if they feel like there's bugs all over them, try to get them to identify where those are. Wipe them off, sweep them off of their arms or wherever they think they are, and then walk them out of the room and tell them that you will have the exterminator come and take care of those bugs. Or, for example, little kids who are being disruptive. If that's their hallucination, then you're going to scold those children and tell them they need to go to a timeout, and you're going to exit the individual from that area. And if they ask about those kids again, you can say, I had their mom come pick them up and take them home. So it's not essential to say, well, you don't have bugs on you. That's not going to work. They believe with every part of their body that there's bugs on them. So change the stimulation by rubbing your hands across their arms. It helps that crawly feeling go away and disrupts the sensation that they're having. And then moving away from the environment. Those bugs are over there, and we're going to get rid of them. We're calling the exterminator. Let's go into the other room until after the exterminator has come. You can put a sign up that says the exterminator was there if you want. Things that'll help them to realize that we've adjusted the plan or changed the environment so that that particular problem isn't going to bother them again, at least right this moment. Probably this hallucination will come back again, so we'll need to redo it again at some time, but you will have something that works, and you can keep doing that same type of thing over and over again, and that can be really helpful. Connecting with a person who has frontotemporal dementia, these individuals lack verbal understanding. They don't necessarily understand what you say in spoken words. So you want to use some automatic social cues. You'll still introduce yourself because that's what we automatically do, but offer your hand to shake their hand. Shake like you normally would. Use calming behaviors. Keep those palms up and open. You don't need to face them front to front. Communicate from beside them. And use redirection when they become hyperfixated on something or in a trance-like state. They're going to need extra time. Don't be surprised. They're sick. We need to help them through this period of time. If you're upset, they're going to feel really upset. So keep your energy positive and upbeat. This is a really great time where you can do some singing. I mean, even row, row, row your boat. Something that they're going to remember, be happy about, and associate with positive things is always helpful. And something that you know. Medications for those with frontotemporal dementia. Agitated symptoms really respond well to antipsychotic medications. If a person has compulsive symptoms. They respond well to SSRI antidepressants. Compulsive symptoms would be like having to touch the door 3 times every time you exit, or washing your hands compulsively. Some people benefit from ADHD meds, and that actually stimulates the frontal lobe. That would be Risperdal, Abilify, those types of medications. So some of these individuals respond to those as well. What is often frontotemporal dementia is often misdiagnosed as schizophrenia, but we need to remember that in frontotemporal dementia, the changes in the brain lead to changes in behavior, emotion, and language, and that they'll have progressive aphasia. The onset is between 40 and 60 years of age, so it's really early onset for a dementia. For schizophrenia, we'll see late teens for guys and early 20s for women when this occurs. And so while frontotemporal dementia is usually not diagnosed until they're at least 40, schizophrenia should have been diagnosed much earlier. Now, in schizophrenia, these patients will see or have distortions in thinking and perception, and they can have some positive and negative symptoms, and they may affect cognition. But in frontotemporal dementia, it's more behavior, emotion, and language that's impacted, even though they may exhibit some hallucinations and delusions at times.